Hey everybody, Dr. Rafich again here from Vet Triage. We are going through this issue of Veterinary Surgery from February 2022, and we're going to be focusing on this report here. Evidence-based evaluation of owner-reported outcome measurements for canine orthopedic care, a COSMIN evaluation of 6 instruments. This comes out of the Department of Veterinary Medicine in Cambridge in the United Kingdom and the AO Foundation in Switzerland. Now, this has a lot of abbreviations and a lot of technicality to it. This paper is similar to the one that we did yesterday that looks at a literature search to find out if there's a consensus for what is the best methodology to determine something, and in this case, canine orthopedic care. Also, in case you're interested here, I have on my YouTube channel, there I am, and we have RC arthritis, a brief discussion. So feel free to look that up if you want more information on arthritis in animals and dogs. So this is my discussion. Okay, the objective is to systematically review the currently available validated owner-reported outcome measurements for assessing pain and function in dogs with arthritis and other joint disease. They used PubMed and Web of Science in December of 2019. And the COSMIN in the title there stands for Consensus-Based Standards for the Selection of Health Measurement Instruments. Results found that 17 publications fit the criteria. The Canine Brief Pain Inventory is 1, the Canine Orthopedic Index is 2, and the Liverpool Osteoarthritis in Dogs is 3. Those 3 provided evidence of sufficient content validity, internal consistency, reliability, construct validity, and responsiveness were the most frequently validated other properties. Both the Canine Brief Pain Inventory and the Canine Orthopedic Index had sufficient internal consistency, whereas the Liverpool Osteoarthritis in Dogs was formative in construct and need not be assessed for internal consistency. No instruments provided information on measurement errors. In conclusion, the Canine Brief Pain Inventory, the Canine Orthopedic Index, and the Liverpool Osteoarthritis in Dogs can be recommended for use in dogs with osteoarthritis. So again, it's going to be a lot of terminology here. But basically, they're trying to figure out what kind of scoring system or whatever measurement tool is best to be used to assess dogs with arthritis. Introduction. The estimated prevalence of osteoarthritis ranges widely from 2.5% to 6.6% in the United Kingdom. Over 20% of dogs older than 1 year of age in the United States of America. This is based on radiographs and clinical data. In human medicine, patient-reported outcomes have been gaining acceptance in clinical practice for improving quality of care. Patient-reported outcomes also provide transparency in outcome assessment to stakeholders through public reporting. Patient-reported outcome measurements are now considered valid, reliable, and important tools for determining safety and efficacy and are typically required for United States Food and Drug Administration approval in human medicine, including orthopedics. When patients are not able to communicate on their own, as the case is for pediatrics, then the Food and Drug Administration recommends using questionnaires specifically developed for observers rather than using a proxy to answer questions from a questionnaire that was designed to be used as a self-reporting tool when patients are not capable of answering themselves. These owner-reported outcome measures, also called clinical metrology instruments in veterinary medicine, are structured questionnaires used as outcome measurement instruments to assess function, pain, and quality of life in pets. The first set of minimum standards for the review of psychometric instruments was published in the early 1990s. Since then, a number of tools have been developed with similar aims. The consensus-based standards for the selection of health measurement instruments, which is COSMIN. This initiative was founded in 2005, and a risk of bias checklist was published in 2010. In 2018, a comprehensive guideline, including an extensive user manual, was published to allow a systemic review of patient-reported outcome measurements. It is the most comprehensive tool available to date, and it's widely used in human medicine for example, by professional organizations to recommend patient-reported outcome measurements for clinical use. So for materials and methods, they used a whole bunch of search terms. The inclusion criteria were original research articles involving dogs with arthritis and other joint-related diseases or pain related to these conditions, and with owners or caregivers' involvement in evaluating pain or treatment outcomes. Regarding the results, systematic literature search. The search identified 12 articles plus 5 additional articles through reading full text or review articles. The 17 described the validation of 6, and I'm going to be going back and forth a lot because they use a lot of abbreviations here. Those articles had 6 owner-reported outcome measures. The Bologna Healing Stifle Injury Index assesses dogs after surgical treatment for cranial cruciate ligament disease and has both owner and clinician assessments. Our evaluation was limited to the owner questionnaire part. Then there's the Canine Brief Pain Inventory, the Canine Orthopedic Index, the Helsinki Chronic Pain Index, the Hudson Visual Analog Scale, and the Liverpool Osteoarthritis in dogs. Instruments found through the systematic search but not included in the consensus-based standards for the selection of health measurement instruments evaluation were, in alphabetical order, the BioArth Functional Evaluation Scales, the Bristol Osteoarthritis in Dogs Questionnaire, the Client-Specific Outcome Measures, and the Vetmetrica Health-Related Quality of Life Instrument. Okay, the next section. Methodologically, the Canine Orthopedic Index was developed with the most rigor and received an overall rating of adequate, followed by the Canine Brief Pain Inventory with an overall rating of doubtful. All the other instruments were inadequate. Okay, regarding overall rating of measurement properties, the Canine Brief Pain Inventory, the Canine Orthopedic Index, and the Liverpool Osteoarthritis in Dogs were rated as having sufficient content validity, meaning relevance, comprehensiveness, and comprehensibility. In regard to formulation of recommendations, based on our assessment, those 3 measurements had evidence of sufficient content validity and at least low-quality evidence for sufficient internal consistency and can be recommended for use. The other 3 instruments were not enough evidence to recommend them, but also not high-quality evidence to conclude they should not be recommended. Okay, discussion. This methodology describes a systematic approach for searching the literature and finding relevant measurements to critically assess the quality of life instruments and validation studies. This systematic approach reduces potential reviewer bias and supports evidence-based selection of such measurements. When interpreting the current evaluation, if based strictly on the measurement standards used in this study, none of these were originally rated to have sufficiently addressed the question of comprehensiveness during their development. Therefore, the 3 that they rated as sufficient in comprehensiveness, resulting in these instruments as having overall sufficient content validity and internal consistency to be recommended for assessing pain and function in dogs with arthritis and arthritis treatments. In conclusion, the recently updated consensus-based standards for the selection of health measurement instruments standards were applied to evaluate canine osteoarthritis and other owner-reported outcome measurements for joint diseases. The Canine Brief Inventory, the Canine Orthopedic Index, and the Liverpool Osteoarthritis in Dogs can be recommended for use in assessing canine osteoarthritis function and pain, but further studies may help improve their interpretability or expand their application into other canine orthopedic conditions. Let me summarize this to make sense, because even I'm a little bit confused as to what we just read, but let me interpret it how I see it. So they want to make the case that if you interview a patient on their orthopedic condition, that should be considered valid information for publication, as opposed to what we always thought as being standard or validated, which is a double-blinded placebo-controlled study, right? Which are the highest of study values, but they're also the most difficult to attain. Then the problem is, well, if the patient doesn't talk, like with animals or pediatrics, can you use a proxy or an observer to fill out a questionnaire? And so the idea here is to say, okay, if we're going to consider a proxy not adequate, meaning a pet owner, but we're going to consider an observer, like a clinician, filling out the questionnaire as being more valid, then when they search the literature on what questionnaires are valid, none of them are good enough in veterinary medicine, because they're always going to be, for the most part, determined based on the pet owner or the observer, or as the observer and not the clinician, to fill out the questionnaire. So when you look at that, out of all of the availabilities in veterinary medicine, they consider these three that we'd mentioned as being like okay enough. And the rest of them were not great, but also there's no evidence to show that they shouldn't be used, but they're just not ideal. All right. So that's the point here. And I like it. I mean, I at this point in time, the way that the veterinary literature is, there are so many weak and crappy papers out there that we publish that you might as well just go to, a resource that at least has been validated in human medicine, and let us at least interview observers with a questionnaire, which still will be a problem for veterinary medicine, because really we need the reviewer or the observer to be the client, the pet owner. And this study does not say, though, that's a strong methodology to this. So a step in the right direction with that. So, all right. Anyway, thanks for the support, and we'll see you again tomorrow. Bye-bye.